Hey everybody, how are you? This is Andrew Knoll. I'm here and I have a pleasure of talking to Dr. Keith Giaquinto from Giaquinto Chiropractic and Digestion Center in beautiful Naperville, Illinois. Thank you, Dr. Keith, for joining me today.
You're welcome.
So we had an episode on community leadership, our first podcast that we met with. Now we're going to be talking about something really special, right? And I'll let you get into it in a second, but I'm super excited. Again, thank you so much for jumping on board and taking your time here. I know you're very busy. So, tell us quickly, for those just kind of tuning in right now, your background, right? How you got started in chiropractic.
Okay.
We all need to know, right?
Sure, absolutely. Well, every chiropractor has their story, right, of how they got into chiropractic. So with me, I was very active as a kid, always playing sports, soccer, basketball, volleyball, always in the weight room. And being young and being active, you tend to get injured. So I started going to a chiropractor, not just for my back pain, but for my ankle or my elbow or my shoulder or whatever I happened to injure at the time. So as I was getting treated and understanding more about the philosophy of how chiropractic work and how the power that made the body is the same power that heals the body, I was very intrigued by that. And I just decided right then and there that that's what I want to do. And I was very fortunate to graduating high school knowing exactly what I wanted to do. So I went in and got my undergrad degree, then went to chiropractic school. And while I was doing my clinical rotation in chiropractic school, my clinician actually exposed me to enzyme nutrition and Dr. Howard Loomis's work with Food Enzyme Institute. And she was like, you got to go hear Dr. Loomis speak. This is the up and coming thing about enzyme nutrition. So I went and got that certification because it's extra training and it's not something that's ingrained in the chiropractic training. And got a postgraduate degree from there. And then was able to practice both chiropractic and enzyme nutrition, and I've been doing it now for 16 years.
16 years, amazing.
Yeah.
You have a beautiful practice here in Naperville now, and kind of what brought you to Naperville?
Well, I graduated from school. I moved out to Santa Monica. Was out in Santa Monica for about 7 years. Moved to Michigan for about a year and a half, and then ended up moving back here about 6 years ago, and came here to Naperville. I knew one person in Naperville, and launching a brand new practice, and it takes a lot of work to do that. So it's a lot of hustle, if you will.
Absolutely. We talked a lot about that in episode number 1 of our Health Leaders podcast with you. So those listening, check out our first episode with Dr. Keith here. So now we're going to dive into a special topic here, which I'm excited about. Tell us a little bit more about what kind of brought you to this topic that we're about to dive into.
Okay, that's a great question. And it's more about, you talk about chiropractors, right? You say the word chiropractor, what do people think about? Oh, neck pain, back pain, right? That's exactly what people think, and that's the stigma that we have in society. And it's not a bad stigma to have because it's something that we're really good at. And chiropractors are great at treating things called subluxations, which we'll get into in a little bit. But what most people don't understand is that a subluxation can actually be the cause of an issue mechanically, or it can actually be the effect of an organ-related issue or a nutritional imbalance or deficiency, which is something that a lot of other chiropractors may not even know about. And that's something that I really want to kind of talk to you about today. And just kind of looking at the body from, well, what does the brain think? Right? How does the brain see the body? How does the brain see health? Because in our culture, we are dangerously misled that, oh, you have this symptom, you take this drug. And that if you have no symptoms, that you are perfectly healthy and fine, which is so far from the truth. Because how many times do people walk into their doctor's office to get their annual physical, they have no symptoms whatsoever, but they run their blood test or whatever, they do some diagnostic testing, and oh, you've got diabetes, oh, you've got osteoporosis, or you've got high blood pressure. And these are all clues and signs of the body saying, hey, I'm not functioning well. So there's a big difference between having no symptoms and actually being healthy. There's a big difference between not having any symptoms and your body performing at peak potential. And that's kind of really what I want to talk about. And how does the brain do that? Well, according to the brain, your body only has to do two things. It has to keep you upright against gravity, and it has to maintain the internal environment, or something that's called homeostasis. And both of those things require energy or nutrition. Okay? Now, with every single cell, organ, and tissue in the entire body, every single cell only asks you to do two things. Give me my food so that I can do my job appropriately, and take away my waste so that I can do my job appropriately. So we engage in our surroundings. We get up and we go throughout our day, and we're engaged in our surroundings through our five senses. And your brain has to receive the right information so that it can process it correctly. But not only that, but then dictate the appropriate response so that homeostasis can be maintained. Okay? And that's what we're talking about, is like health is just not the absence of symptoms, but it's how the body is functioning. And there's a big difference between the two of them. Okay? So, what can cause your brain to not receive the right information? What can cause your organs, your tissues, and your cells to become nutritionally deficient or imbalanced, and the waste not being taken away, and your body and the internal environment becoming toxic? And according to Hans Selye, who was a medical doctor who spent his whole life's work researching stress and the effects on the human body, that's what his conclusion was, is that stress is really the only condition that we have to fight. But when you say that word stress, it seems like it's a very big and vague word. It doesn't really have a lot of meaning to it. You go to your doctor's office, oh, it's just stress. But what does that mean? It's like doesn't have any meaning to it. But to your brain, it has a very specific meaning. And what most people don't understand is that stress comes in three separate forms. You've got mechanical stress, you have emotional stress, and then you have nutritional stress, which I like to call men. Three forms of stress is men. Mechanical, emotional, nutritional.
So those men cause a lot of stress, huh?
Exactly. And that's for the women out there. They're going to love that. It's kind of quick and easy, and it's catchy,
Absolutely.
But when we're talking about mechanical stress, what are we talking about? Well, we're talking about old musculoskeletal injuries that may not have healed correctly.
No.
So if they haven't healed correctly, then they're going to continually give a stress signal into your spine, your brain, and can cause problems. We're talking about poor posture, okay? And we're talking about subluxations. Emotional stress, we're talking about, anxiety, depression issues, financial issues, relationship issues, what have you. Who doesn't have some form of emotional stress?
Absolutely.
And then nutritional stress is the obvious one, is diet, of what's on the end of your fork. But also, too, what nobody thinks about or isn't even talked about when it comes to health is digestion. How well can your body not only digest, but actually absorb the nutrition from the food that you eat? Because I have a lot of patients that come to see me that have a very clean diet, they exercise regularly, but yet they still have all these health issues. So again, it's not a question of their lifestyle, but it's a question of how does their body perform, or how is it not performing? That's what's giving them their health issues. Because when homeostasis is out of balance and your body is nutritionally deficient, you're going to have symptoms. You're going to have health problems. And that's what most people don't really understand. Okay? So that's kind of, but one of the purposes of this podcast, though, is that understanding the differences between subluxations being the cause of an issue versus an organ-related or nutritional effect.
That's amazing. I'm very, very fascinated already. You hooked me. This could be a great episode for our fitness podcast as well. Actually, these our trainers and our fitness guys would love this. By the way, but keep going.
Yeah, absolutely. So it doesn't matter to your brain or your body what form of stress or what combination of stress, because sometimes people have a combination of all three, mechanical, emotional, nutritional, and sometimes two of them can actually be primary, right? Somebody can be emotionally overwhelmed with something, which is then going to burn up more nutrition in the body, which is then going to cause the subluxations. So it's a triad of health that affect, and there's a lot of overlap between all three of them. But it doesn't matter when patients come to see me, regardless of what they have, you have to identify where that source of stress is first. Is it mechanical? Is it emotional? Or is it nutritional? Because if you do not identify where on that person's body that source of stress is at, and if you don't manage it better or minimize it, it's not about eliminating it, but it's about minimizing it or managing it better, then that person is simply not going to heal. And they're just going to be spinning the wheel. So no amount of medication or adjustments or supplements are going to correct that, because when we have stress on our body, how does our body combat all three forms of stress? It does it one way, and that's with more nutrition. So when you have become nutritionally deficient because you have a weak digestion when you're stressed, then your body can rack up this nutritional deficit, and it just keeps growing and growing and growing. And that's what can actually cause and perpetuate chronic subluxations in the spine. Make sense?
Yeah, it does.
Because, we have 24 vertebrae from our head to our pelvis, and every single vertebrae has a spinal nerve that comes out from each level. Well, every single nerve goes to three separate things. It goes to an area of your skin, it goes to a muscle group, and it also goes to an organ system. Okay? So when you have, let's first talk about subluxation and what is a subluxation, right? Subluxation is an aberrant motion in your spine, or where two vertebrae are restricted and they don't move appropriately as they should. That's what a subluxation is. And every single time a subluxation is present in the spine, you're going to have muscle contraction at that level. Okay? Now, this is muscle contraction. This is not muscle spasm.
Right.
I want to be very clear about that. Because when you have a muscle spasm, you will know. Because you're going to be in a lot of pain.
Right.
But there's varying degrees. It's not always black or white. Because you get back to talking about chiropractors, neck pain, back pain. Pain only shows up in your spine in the most acute or extreme situation. 9 times out of 10, when you have that muscle contraction, you may not experience any pain. What you will experience is loss of function. And what are some early warning signs of loss of function? What does that look like in the real world? Well, you could become fatigued. You could have headaches. You could become irritable or restless. You could have insomnia. You could have digestion issues, right? Bloating, gas, constipation, diarrhea, right? Those are some early warning signs that may show up before you actually even experience any back or neck pain. Okay? So kind of getting back to what subluxations can be, is it's like a mechanical cause or a nutritional effect or organ-related effect. So what happens is that if you have a purely mechanical issue, let's say you've got some neck pain or you got some mid-back stiffness or tightness, and if it was purely a mechanical issue, well then getting adjusted, being educated on posture, working on stretches and exercises to strengthen your postural muscles, well that should take care of it. And that should fix it relatively quickly.
Right.
But if the mechanical solution to that is only a temporary fix, meaning that the adjustment, the stretches, the exercises only last a few hours, a few days, or a week at best, and the symptoms come back at the exact same spot, at the exact same intensity, then you have to look elsewhere. And this is where the organ or nutritionally related imbalance comes into play. So, for example, right? We're talking about the mid-thoracic spine, right between your shoulder blades. The nerves that come out from there, they go to your digestion organs. So if you happen to have stiffness or tightness and or pain, or a combination of all three of those on the right side of your mid-back, where do those nerves go to? Well, they go to your stomach, they go to your liver and your gallbladder. So there is a visceral stress point up under this front rib cage here on the right side that has to deal with protein digestion. So if you are getting adjusted and you're still having that stiffness there, then that organ-related stress or this muscle contraction here is an indication that your body is struggling at digesting protein. So taking a supplement in the form of an enzyme nutrition to help support protein digestion can then help to relieve that muscle contraction and relieve the stress or that tightness on the right side of your mid-back. Okay? Make sense?
Yeah.
So if it happens to be on the left side, right, where do the nerves that come out from the left side of your mid-back go? Well, they go to your pancreas and your stomach. And what is the pancreas responsible for? Carbohydrate digestion. So you've got a visceral stress point up underneath the left rib cage here that can indicate carbohydrate issues. So if you're getting adjusted and after the adjustment, you turn the patient over on their back and you palpate these areas, after the adjustment, this muscle contraction should be gone. But if they're still there, or if one side's there, then that means it's an organ-related or nutritionally related issue. So you're going to need to help support their digestion process with either enzymes to help with carbohydrate digestion or enzymes to help with protein digestion in order to really help minimize that muscle contraction and the symptoms in the mid-back area.
Okay, got it.
Make sense?
Yep.
So just kind of moving up from the spine a little bit, let's go over a couple examples here, more examples. The upper thoracic spine, right up here, like kind of above the shoulder blades here. Well, T1, T2, T3. Well, where did those nerves go to? They go to your lungs, they go to your heart. So a lot of times the people that have asthma or breathing related issues have subluxations up here in their upper back area. So looking at that from purely a mechanical perspective, people that have poor posture, the rounded shoulders and this anterior head carriage, is going to put extra strain mechanically on those nerves, which what research shows can decrease lung function by 30%. So if you correct the posture and you correct the mechanics and they're still having issues, well, then you got to look at the lungs from an organ-related or nutrition related issue. So let's look at that. What do the lungs do in the body? They are an organ of elimination. They're trying to eliminate toxins out of the body. So if you've got digestion issues and you've got leaky gut problems and your internal environment becomes toxic and you've got lymphatic congestion, well, then that's going to put extra strain on the lungs at trying to get these toxins out. So then you've got a lot of these toxins that are just sitting there in your lungs. Then you walk outside and you breathe in that pollen or that pet dander or whatever, or you're emotionally upset or overwhelmed, then that's going to trigger your asthma attack. So nutritionally supporting the lungs that way and looking at the gut and cleaning up the gut can help to relieve that muscle contraction in the upper back area. Make sense?
Yeah.
And the last example I want to go over is something that's pretty common, is subluxations right here at the base of your skull.
Okay.
So again, where do the nerves come out from here? They come out into the head, right? The ears, the eyes, the sinuses, the jaw. So if you're looking at that from more of a mechanical perspective, well then, just observing people's posture, right? Nobody talks about posture, right? Posture is the most talked about thing that has a dramatic impact on everyone's health. Unless you're in the military or you were a professional dancer or competed in dance, nobody ever talks to you about posture, which is why chiropractors talk so much about posture, because it is very important in your overall health. So when you have those rounded shoulders and this anterior head carriage, it's going to put extra strain and muscle contraction and cause subluxations up here at the base of your skull. Well, what can you experience with that? You can experience eye problems or ear problems, sinus issues, allergies, TMJ problems, all from that anterior head carriage. So again, looking at it from a mechanical perspective, well, let's work on posture. Let's get them adjusted. Let's strengthen the postural muscles so that you can actually stand upright against gravity better, which will then take a lot of stress off your spine and your nervous system and can, not burn up all that nutrition in your body. So if the mechanical approach is only a temporary fix, then you have to look at, well, what else is going on? And a lot of times with sinuses, so let's just take the sinuses for example. What do the sinuses do? They are a pathway of how the body, again, eliminates toxins from the body. Right. So if you've got leaky gut issues or digestion problems and a lymphatic congestion, then again, those toxins just sit there and they deposit there. Then you walk out into the high pollen count, right? And you breathe that stuff in and it sticks to those toxins, and that causes your inflammatory response, and there's your allergy issues. So kind of cleaning up that way and supporting the sinuses can actually, people don't realize this, that people that suffer with allergies their whole life, is that yes, you can prevent them. It's not all about taking Claritin or a decongestant your whole life, right? You can prevent them. But the problem is that are people willing to stop doing what makes them sick? And a lot of times it's diet related. So that's kind of what I'm talking about with subluxation. Is it the cause of an issue mechanically, or is it the effect of a nutrition or organ related imbalance?
Got it. That is great. That now, just by simply laying that out, you have real solutions for your patients that come into the practice. And obviously it's a case-by-case basis.
Yeah.
But you've kind of also outlined a process or procedure that you take with each person when they do come in, identify the source. So then you can attack you have a battle plan for them.
Exactly. And that's the biggest thing, is because I could have 10 people that walk in with fibromyalgia or allergies or eczema or whatever it is that's causing what's ailing them, but there's going to be 10 different causes of why it's happening. Because everybody perceives stress differently, and everybody's ability to manage that stress is different. So everybody's body is literally their own walking chemistry set. And you have to figure out, well, is it mechanical, is it emotional, is it nutritional, or is yours more nutritional because your diet is basically crap, right? Somebody is completely different. When somebody walks in with seasonal allergies that they don't exercise at all and they eat nothing but processed and fast foods and genetically modified foods, like that person's body is completely different than somebody that walks in with seasonal allergies that eats very clean and exercises 4 times a week, right? So it's completely different, even though their symptoms may be the same. Right. And it's just trying to troubleshoot and problem solve what is stressing out that particular body's system the most. Because if we don't find out what's causing it, then they're not going to heal. It's really that simple.
I'm curious. So you gave great examples. I'm curious at how this actually is implemented. So, because we're talking about practice building and things like that. So
Sure.
Of course my mind goes this way. When you have someone come in, you have I think it feels like, correct me if I'm wrong, but a more in-depth intake process for each person.
Yeah.
To identify what your battle plan is with them.
Exactly.
And then do you recommend treatment plans for them? Is it, because if everyone's different, but yet there's specific solutions, there's solutions and fundamentals to all of this for the solutions. Do you have specific plans that you have consistent throughout your practice that you recommend one or the other with?
Well, that's a great question, and I kind of break it down this way. I have a mechanical service that I offer our community with chiropractic, adjustments, posture, stretches, exercises. I also have a nutritional approach too, which is a completely separate workup. And this is what I've learned through my training, at the Food Enzyme Institute with Dr. Loomis, that he has actually created a system that is, involves, a symptom survey. I have people do a food log of everything they're eating and drinking for 6 days, including keeping track of their bowel movements. We do a 24-hour urinalysis, which is a kit that I give my patients that they take home, and they collect their urine for 24 hours, and it tells us a great deal of information about the digestion system and any bowel toxicity or other things that are going on in the gut. We can do blood work to see how much damage is done, but then there's also a fasting exam that I do, where people come in on an empty stomach, right? These 2 stress points that I'm talking about here, well, there's actually 43 different ones on the body that tell me something different about an organ system or a nutritional imbalance. So my patients come in first thing in the morning on an empty stomach. I adjust their spine to minimize all the mechanical stress to their system, and then I evaluate these 43 stress points when they're on an empty stomach. Because the stress points are going to be positive because your body's waiting for its next meal. But then I give them a balanced food to eat, which is a tablespoon of food mixed in water that they then drink. We wait 45 minutes to allow their body to digest and absorb and get that nutrition to where it needs to go. Because if your body can properly digest and absorb that, well, then the stress points that were positive before, well, they should disappear. But if it's positive before and it's positive afterwards, now we've got an area of where their body is struggling nutritionally. But what if they've got 20 things that are double positive, right? Where do you start? Because when you're talking about supplementation, a lot of times there's a lot of guesswork that's involved with that. Well, this whole system and the Loomis system, it takes all that guesswork out of the equation. I know exactly what that patient needs right now, but also what priority system and what to attack first. Because a lot of times we're talking about supplementation and stuff like that, you're chasing symptoms around the body because you don't have any concrete way of measuring where their body is at. So if you're a dog chasing a rabbit in a field, what are the chances of another rabbit popping up? So then which one do you chase? This whole system wipes that away. And it's like, I don't chase symptoms around the body. I know what homeostasis looks like. I know how to measure it. And I know how to measure the deviations from normal. Because once we can find that deviation, then we put you on a program that brings your body back into balance. So coming back to the mechanical or the nutritional, sometimes people just come to me for the mechanical stuff, and we do great with that. Sometimes people just come to me for the nutritional stuff. They already have another chiropractor. So we just work nutritionally with them. But a lot of times, most of my patients get both.
Wow, that's amazing.
And that's kind of how you have to figure it out.
That's amazing. I can tell right away, just the type of clientele coming to you, right? They automatically come just because, obviously, in the first episode, if we haven't caught it, grab the first episode because he tells us how to get out there in the community and educate on different topics and areas of really problems that we're facing, right, as a community to get healthy. So you automatically separate yourself from all other chiropractors on the area. I just know that just by you educating us today, right? And so the clientele that comes in is already looking for, based off of your education, something completely different. And obviously they value you night and day from some other health professionals, even fitness professionals out there, which is great. You're differentiating yourself. So from a business standpoint, that's my mind.
Sure.
It's amazing. So much more value from front to back. You already sold me in terms of coming in here and getting help from you as a professional. So catch your first episode, right? Talk about how to get out there in the community with this. Where can they find more information on this whole system, right? If they're looking maybe to learn a lot more about it, but also maybe they're looking at like, hey, maybe I need to revamp my practice a little bit.
Sure. Well, the Food Enzyme Institute, you can go to their website, foodenzymeinstitute.com. Dr. Loomis has been teaching this, for 39 years now. Since 1985, he's been teaching this system. So you can go and actually get trained and learn more about enzyme nutrition there, because he teaches you all this stuff of how to approach. See, the thing is getting my chiropractic training taught me how to be the doctor and how to be the chiropractor. Dr. Loomis taught me how to be a healer, which is completely different, because a lot of times people think chiropractic, neck pain, back pain, and what most people don't understand is that chiropractors specialize just like the medical community does, right? You go to a chiropractor, some chiropractors are more sports medicine oriented. Some chiropractors are more pediatric, and pregnancy. Other chiropractors are more functional med. So there's different things that chiropractors can specialize in. Mine just happens to be in internal health.
Right.
So,
Amazing.
And that's things like you can have 5 chiropractors in the same building, and they're all going to practice differently.
Right.
So it's not about competition, because there's more than plenty of people out there that need our help.
True.
It's just more about, well, what kind of a practice do you do? What do you stand for? And how do you spread your message?
There we go. That's the best answer. I love it. Do you partner with a fitness professional? Any gyms around the area?
I do not, actually.
Oh, okay. So maybe partnering up would kind of round off a little partnership. I'm all about partnerships.
Oh, absolutely.
I think this is one of my vehicles for the bigger mission, which is how can we all team up in a synergistic way, at least, to provide the best care for people in the area, holistic, right?
Absolutely.
Preventative care.
Yep.
That's what it comes down to in this world, right?
Yep.
So what is one big tip, a big note to leave the chiropractors listening with, about this whole system, about your philosophy and everything?
Well, it's more about when people have subluxations, like we all have we're not perfect. We all have weaknesses. So when your patients come in and they have subluxation patterns that are chronic in nature, right? The mechanical approach may not be enough. So that's where you have to look elsewhere and maybe supporting the body nutritionally to help support that area of the body.
Got it. So love it. And obviously we got to leave on how our chiropractors listening can reach out to you specifically too as well, because obviously you've been practicing this for a little while, so you're the expert here too. What is the best way for them to reach out for more information, more background, tips, advice, mentorship with you?
Well, they can just call the office, 630-246-2627.
Perfect. Love it.
Or go to my website, Giaquintochiropractic.com.
That's it. So that's all the time we have. Obviously, so much information and value here. And catch Dr. Keats, I keep saying it, but catch his first episode with each other on how to get out there in the community and expand on these topics to the community so they can understand what true health is and get you out there as that health leader, health authority, and that healer, as we always say. Dr. Keith, anything else you want to leave with?
Well, sure, why not? I could talk forever. No, the biggest thing is that, we have been dangerously misled in this culture that our health is not our own, that we are a victim to our genes, and when you have this symptom, take this medication. And what I want everybody to know is that you are in control of your health. You and you alone. Health is just like happiness. Nobody else can make you happy, right? You have to make yourself happy. And be the advocate for yourself. And that's why a big part of what I do is education. I do workshops, I do lectures all the time in helping to educate the community of what true health and healing is really about. So that people can, number one, gain the knowledge of how their body works, just like I explained here today, right? But once they have that knowledge, actually give them the tools and the vehicle of which they can do to manage their stress and their health on their own. That's really what it's about. I don't want to give my patients a fish so they're fed for a day. I want to teach them how to fish. Let's face it, the human body is an amazing machine. It's an awesome high-performance race car. But who teaches us how to walk through it so that we can get the best performance from it? Mechanically, emotionally, and nutritionally. And that's kind of really what I do. I put the power right with the patient. Now, whether or not they're willing to accept that responsibility, that's a completely different story. But those that do, and I kind of consider myself more of a wellness coach than anything, because when the student is ready, the teacher will appear, and I am usually the teacher for most of those people. And when people come in and be that student and they're open and they suck up all the knowledge and they fully engage it in their health, we get the best results with them.
Love it, love it. It's exactly why we had you on, Doctor, because we knew that you could bring the heat with all of this and really educate everybody, not only our chiropractors on this episode, but just getting out there and helping people take responsibility for their own health, knowing that they're the ones responsible, not anybody or anything else, right?
Yeah.
So they can take charge of their lives, because you know that when they're healthy, they're optimal, they're best, they're going out there inspiring others to do the same.
Absolutely.
And that's what it's all about,
it's
right?
living by example, right?
Love it.
Because how well can you be the best spouse, the best parent, the best citizen in our community if you are tired all the time, if you're irritable, if you can't sleep and you don't feel well?
Right.
You can't.
Right.
So it's really about taking that ownership and putting your best foot forward so that your body can perform the way that it was designed, so you can live up to your fullest potential.
Absolutely. I'll give you guys a visual leaving this note. When when you're in a plane and the oxygen masks come in, this is a metaphor,
Yep.
right? What do they tell you first? Put your oxygen mask on first. Help yourself first, so that you can help maybe your kid next to you, or whoever else is next to you, right?
Exactly.
Do that first so you can help others. That's what it's all about. Take care of yourself first, your best, so you can take care of others.
Exactly.
Dr. Keith, that was absolutely amazing. You have to follow Dr. Keith, everything that he's doing, where he's speaking, where he's educating, and then reach out to him, because obviously he's doing not only amazing things in the community, but I know for other chiropractors around. So thank you, Dr. Keith, again. We could talk for hours, but
hey,
thank you so much for jumping on and your valued time.
You're welcome. Thank you.